So let's start with some information. The ratio of boys to girls with ADHD is 3 to 1. And boys are usually identified earlier because of behavioral challenges. Last week we talked about girls with ADHD, so now we're doing the other side. Um, Boys are more likely than girls to be hyperactive, and both sexes can be impulsive and inattentive as well as hyperactive, but we see more hyperactivity in boys. The symptoms for boys with ADHD can look like running and shouting when playing, both indoors and outdoors, a lack of awareness about their body and space and the volume of their voices, rough play and not knowing when to stop, maybe a bumping into things or some clumsiness. Um, Moving a lot, whether you're seated or standing. And so uh, boys have a higher frequency of being diagnosed with ADHD as children, and they show more symptoms of oppositional and aggressive behaviors. Um, Often these behaviors are sometimes excused as boys being boys, which is a real problem because then we'll miss the actual ADHD that's occurring. There's a real difference for boys and of course for girls, but of being active and the nonstop activity being driven like a motor that we see in boys with ADHD. Boys with ADHD experience fewer problems in an activity-oriented world with ADHD traits like risk-taking and aggression being viewed in a positive manner, which is why sometimes we might overlook what actually is ADHD in favor of just being, a gregarious, limit-testing boy. Boys often struggle with managing their emotions and can misinterpret social situations or miss social cues. They may resort to humor or being a class clown as a way to deflect their issues or cope with any discomfort they're having socially, or try to, engage peers in liking them. Their friends may find this annoying. Boys relate more through shared activities, which makes difficulties in verbal expression and reading social cues less pronounced. Boys can be excluded from their friends because of increased aggression, calling too much attention to themselves, or not sharing peer concerns about fairness. Boys will receive negative feedback from early on about these behaviors that are drawing attention to themselves, or they're missing cues, or they're not settling down in the way that adults would like. And this negative feedback from a young age can increase their stress that they experience, as well as anxiety, and contribute to low self-esteem. Boys need to be taught effective coping strategies for managing limited verbal impulse control and emotional dysregulation. So they need coping strategies to manage that they have these impulses, they say things or they do things, and their big feelings, which also can sort of be behind acting out. Of course, like girls, boys benefit from direct instruction about organization, planning, prioritizing, flexibility, and time management. Building awareness of themselves is particularly important for boys with ADHD. In general, boys mature more slowly than girls. We know that. And boys with ADHD who already, like girls with ADHD, lag up to 3 years behind in brain maturation, make this process more complicated for themselves. So as questions, we want to ask them questions that help them understand themselves, that foster that metacognition, that self-evaluation. And these would be questions that would be goals to help them understand themselves more. What type of learner am I? What am I good at and how? When am I able to focus? What do you notice about yourself when you're doing X or you're with people at Y? What helps you pay attention in class? What distracts you during your homework? When are you planning to do X? And how can we assess the time needed for that? So we want to be explicit in teaching skills, but we also want to ask questions, that are that require self-reflection and integration. So I'd like to move now to questions. So the first question is, how can I deal with my son's lack of motivation? And right now, lack of motivation is something many kids are dealing with, whether they're boys or girls with ADHD. And I think the way we want to start dealing with a lack of motivation is to get a sense of why. Kids are not motivated. Where are they motivated in their lives, of course, but what's blocking them from motivation right now? Are they fed up with their screens? Are they frustrated with online learning? Are they tired of being home? Are they sick of the whole thing? Do they barely not even remember what their life was like beforehand? So the way we want to deal with motivation is to break tasks down into smaller pieces. So we know, of course, that initiation is a key executive functioning skill. And what helps with initiation is when tasks actually seem doable. And how do tasks seem doable? They seem doable when they're small enough to actually get started and when we can see the end of completing them. And this is very hard for a lot of kids with ADHD. So we want to break down the things that they need to do into smaller chunks and also set up a situation for success. Where are they going to do their task? For how long? Do they need a break in the middle? Do they like to work by time? Some people say, I want to do 10 minutes of math and then take a 2-minute break. And some people say, I want to do 15 problems and then take a 10-minute break. So let's ask your sons what helps in terms of their motivation, helps them keep going. Okay, I'm getting some more questions here from Annie, which is fantastic. Ashley says, my son is 11. He is very emotional. He's easily frustrated and has low self-esteem. He's having a hard time in school. When boys with ADHD are sensitive and emotional, they can really struggle, not just in school, but with other boys. And so their self-esteem, they don't is lower, not only because they don't have a sense of what they're good at, but they also don't have a sense that other people like them or want to be with them. So we want to help identify, what does your son think he's good at or good enough at? What are some of his interests where he demonstrates an ability that you can lean into or beef up a bit so that he has some things to do that actually interest him and make him happy. Let's see, another question from Esther. How do I keep my boys focused better? Well, focus, of course, has to do with interest, just like motivation. So the first thing we want to do is find out, what interests them. How do they like to work? When they sit down to do their homework or when they do a task, do they want to do the hard thing first and then get that out of the way and then kind of do the medium and then the easy? Or do they want to do that harder thing, the easy thing first to kind of get rolling? How long can they focus before their minds drift? This is a great question to ask kids. Where do they like to drift off to? And to get some information from the teacher about that. Because then we want to set our work periods accordingly. If your child can focus for 8 minutes, then having them focus for 20 or expecting them to focus for 20 isn't realistic. We want to do 8 minutes, then take a quick body break, and then another 8 minutes. Brandy says, my son is 15 and his self-esteem is affected. So a lot of times by the time kids get to be an adolescent, they've heard so many negative comments about themselves, what they could do differently, what they could do better, how they should listen, or corrections. Don't do that, sit here, be quiet. This affects them. They also notice now by the time they're 15 that they're different. They process information differently than a lot of other kids do, and not necessarily in a way they feel good about. So we want to shore up the challenges and lean into the strengths. So your son is 15. What makes him feel good about himself? When does he feel good about himself? Does he have a couple friends? He doesn't need 7. He needs really two, one to be with, and then the other to be with when the first one's busy. And what does he do when he's with his friends? If it's gaming, that's fine. You know, he has to have some kind of outlet. And for now, at least in the last year, it's been very difficult for kids to connect with each other. And for boys with ADHD, remember that their brains are, as with girls, often lagging in a number of executive functioning skills by about 3 years. So he is 15, but in some key aspects of his executive functioning development, he's more like 12. And so he can't actually keep up sometimes, and that doesn't feel good. Anna asks, will my grandson, age 6, grow out of this? About 5 to 10% of kids who are diagnosed with ADHD grow out of it. And we're not sure if they actually fully grow out of it, or if what happens is they are they accommodate it, they learn to live with it. Usually we don't reassess people as they age. It's like, oh, I have ADHD and this doesn't bother me so much anymore. I've learned how to manage that. And so, we don't know, but the statistics say somewhere between 5 or 10%, if you can believe them. Okay, more questions. Fantastic, Peter. Even as an older male who was diagnosed with ADHD at age 25, I get frustrated by the more advanced tasks and feel like a failure if I make a mistake. Oh, I feel like I'm not even normal at times because of this. Is this normal? You are normal, okay? You are normal. You have a neurodiverse brain. There are people who are neurotypical and people who are neurodiverse. Neurodiverse thinkers are creative, outside the box thinkers, alternative learners. And you may get more frustrated by advanced tasks because of how your brain processes information. That's okay. It's not about a failure. You know, I think that model of success and failure is so toxic. To me, success is, do you have people you love in your life who love you? Or are you healthy? Do you take care of yourself? Do you like yourself? Do you eat? Do you eat well? Do you have fun? So these, you know, the measures of success maybe that apply to you may be much, maybe different than the ones you actually are applying to yourself. You know, if you're trying to be like, some famous, uh, businessman or woman, you might not be like that. You might be different. But let's try to think about the ways in which you are doing well. And I would encourage you to take some time at the end of each day and write down in a little book next to your bed 3 things that went pretty well that day. Doesn't have to be perfect, but 3 things, because we have to shift your perspective from noticing the ways that you don't measure up, you think you don't measure up, to the ways that you actually are doing great and fine and measuring up enough. Stephanie says, I'm trying to connect to my son and all I get is, I don't know. Stephanie, this is very common for boys with ADHD because their verbal skills mature a little more slowly than they do for girls. Not all boys, and of course not all girls, but in general. So the questions that you're asking might be questions that he actually doesn't know the answer to. So if your son is saying, I don't know, like when are you going to do this? I don't know. What do you think you need to help you get to this done? I don't know. What I would encourage you to do is slow down with him and say, okay, what is needed in this activity? Let's take a minute and think about it. You know, let's see what the assignment says. Walk through the steps with him. It's very hard for a lot of kids with ADHD to do that planning, prioritizing, to see what they need, in what order, the sequencing, and to prepare for it. And so if he doesn't know, he really may not know. And what he needs is permission not to know, so his anxiety can go down or his anger can go down. And then he can say, then you can work with him together on figuring it out. Veronica says, my son is 13 in 7th grade. He is doing great in virtual learning. Fantastic. My concern is if he goes back to school, all the emotional stress is going to come back as well. But he needs to learn coping skills and to regulate his emotions. What's your opinion about that? Well, that's a really great question, Veronica. And I think, first of all, I just want to say congratulations that your son is doing well in virtual learning. Not everyone can say that about their children. Um, Now, he is nervous about going back to school because of the stress. And you don't say what kind of stress. I'm curious about what kind of stress he experiences. But he does need to learn coping skills and how to regulate his emotions. And what I would do in this situation is I would pick one social skill to focus on and one type of emotional regulation, a tool or a technique that he can use. So if he's learning a social situation, he might need a phrase or he might need some practice on how to manage that. And if he's learning to regulate his emotions, to really work on one at a time. That way he won't feel overwhelmed. And to clarify with his teachers, what he's working on, if he has a 504 or an IEP, to talk with the team or to talk to his counselor at school. Bia says, any successful way to calmly get them off their electronic devices when they have time limits? So we could do a whole session on how to get kids off electronic devices. Maybe we should. But the thing that we want to remember is that when kids are playing games, particularly, or they're engaged in using their screens, it's a high dopamine activity. There's a lot of immediate reward that comes right there. There's pleasure and there's interest. Getting off the screen usually means going to something that's not as fascinating or as fun. And so it's hard to get off the screen because why would you want to leave something that you're enjoying and do something that you don't enjoy that much? So what we want to do is to try to help them ease off the screen by easing into something that they like to do. Maybe it's food. Maybe it's, shooting some basketball hoops before doing homework. Maybe it's playing a game of cards. We want to help them leave the screen into something that actually appeals to them. We also want to help them talk to themselves. So when it's time to get off the screen, what we want to help them do is to be able to say to themselves, I'm leaving my screen and I'm moving to this other activity. Why do we want to do that? Because they need time to transition. So if there is a time limit, when is the warning? Because for a lot of kids, the warning can't be 5 minutes before it's time to get off because they're playing with other people. They need 15 minutes, and then they need a 5 minute, and then they need to go off at a certain time. I hope that helps you. Is there any way you can suggest that I can, any tool that you suggest that I can use or do to get my son focused enough to tidy his room? Amanda, break it down, put some music on, and start small. First, we're going to pick up all the socks and underwear from the floor and put those in the hamper. Then we're going to work on the shirts. You could create a list that he can refer back to if he's old enough, but he might need you to be present, a body double, while he's doing that. And maybe you can be the folder or something, or you have a certain role. But he may not be able to do this on his own very successfully. And rather than being mad at him that he can't do this on his own, look at it as an ADHD issue. It's overwhelming. It's messy. It's disorganized. I don't know where to start and I hate doing it. Why bother? So we want to break it down, and maybe what he can do is 10 minutes every day. Or some kids want to power through it and do an hour. Great. How can you make it a little more fun? Can you play some music? Can you laugh about the number of things on the floor? Can you brainstorm about how to keep his room tidier in terms of the organizational mind that he has? What makes sense to him? Where things could go? Does he want to organize by color, by utility? Help work together and help him figure out a system that makes sense for keeping his room a little bit tidier. Mayan asks, can you talk about ADHD and depression with boys? Yes. So ADHD occurs somewhere between 16 and 30% in children with ADHD. And depression looks different, it can look different in different people. But in boys, I usually see two types of depression. I see anger, and anger is the gatekeeper for lots of emotions for boys and for men. So for sadness, for fear, for hurt, um, for loneliness. And then the other kind of depression I see is usually related to social isolation or loneliness. When boys are depressed, boys with ADHD are depressed, they have lost sight, as most people do when they're depressed, of the bigger picture, of zooming out. And so we want to help boys they're stuck in the weeds, and we want to help them see the field. How are we going to do that? So we want to try to notice what kinds of things get them up every day. What helps you get up out of your bed every day and get dressed? What's something that you like to do? And maybe it would be useful to talk to someone. Now, a lot of boys will be like, ugh, I don't want to do that. But individual therapy for depression can be helpful. Individual therapy for treating ADHD is less than helpful until kids get to a certain age, somewhere in high school, where they have the capacity to reflect on themselves better. But for younger children, it may or may not be helpful. You want to try to meet with someone and see if the therapy will help your child. The depression can often come from comparisons to other boys who seem to be doing it better or have it easier. And the loneliness of feeling and the judgment, I guess, the judgment of, what's wrong with me? Why aren't I like that? So I think it's important to watch for isolation. I think it's important to watch for explosions, anger outbursts. Anxiety can also be related to a depression. In fact, untreated anxiety can lead to depression. So I think if you're concerned about a son or who has ADHD and is seeming to have symptoms of depression, I would talk to your primary care provider and think about getting some counseling, and maybe start with family counseling and see how that goes, so that he's comfortable in the situation and might want to do something where he meets sometimes with the person alone, or maybe mostly with the person alone and sometimes with you involved. Okay, I'm going to the next batch of questions. Stephanie says, my son doesn't take in any positive feedback. He's very sensitive. So what I'm hearing from you, Stephanie, is that your son is super critical of himself. And this happens a lot for kids with ADHD, particularly kids who feel like they're not measuring up. And I used that term before, and I'm using it again because there's a whole conversation in their heads of the negative self-talk monster, basically. And this negative self-talk monster is just criticizing them for everything they're not. And so when you say something positive, they don't really believe you, because if they believed you, then why would they be having all these challenges somewhere else? So what we want to do is to actually help him hear what you're saying. And so you want to make eye contact, deliver the feedback, and have him repeat it. And make it super specific, and don't do this more than like once a day, because kids won't agree with you or participate. But we want them to say, hey, I notice you're doing a really great job clearing the table. When I ask, what did I just say? You think I'm clearing the table? Yeah, I do. High five. You can't make him absorb it. You can just do your best to make sure that it's received. Melanie, how do I help my middle school son keep friends? He is constantly teased because of his immaturity and trouble focusing. Ouch, Melanie, that really hurts me. I think that one of the things that I would want to do to help a middle schooler who's having trouble making friends and being teased because he can't focus is to figure out um, with your if you have a partner, or to talk to a teacher or a counselor at the school, who are some other kids like your son? Who does he sit with at lunch? Who does he sit with in classes who actually may also have ADHD or can understand some of the challenges he lives with? Um, when kids can't make friends, particularly middle school, it's just so sad for them and for their parents. They're really hurting. So again, they don't need 7 friends, they need a couple friends. And this is true for girls as well, quite honestly. I have a client in my practice, and she's a middle schooler, and she said to me, I can't tell when someone is a friend or just an acquaintance. And so I'll treat them like a friend, but then they'll act like an acquaintance, or I'll treat someone like an acquaintance who's actually a friend. It's very confusing for me. So in this kind of situation, some of the challenges for your son, maybe he just lacks some social skills. Could he do an improvisational theater class? Is there a social skills group that he could attend that would help build his confidence? And who are some kids with whom he shares an interest? Or historically, you have family friends who you could invite to do something with as families, so that the pressure isn't on him to do something one-on-one. Emily asks, do you have any good information on how to get them to study for a test? What would some good strategies be to prepare for a test? Well, I mean, I think that depends on the subject and the student, of course. Good strategies would be, familiarizing themselves with the information, piece by piece over time, practicing certain problems, explaining what they're reading or learning to you, so that they can demonstrate that they understand it. Practicing with you, if they have a presentation or they need to do math facts or historical facts, using index cards to learn one thing at a time. Brandy asks, does social anxiety pair with ADHD? My son suffers from anxiety. Yes, actually, social anxiety does pair with ADHD. In fact, 34% of all kids who are diagnosed with ADHD have some form of anxiety, and I believe that's low, as do many of my colleagues, because those are only the reported diagnosed cases that are measured, and some by the invisible measurers above. Um, but I think that, yes, anxiety comes, and so does social anxiety, particularly if you're boys. I mean, what is important when you're a boy? Your athletic prowess, if you're funny, and sometimes if you're smart. And so if you're struggling in any or all of those areas, you will probably struggle with anxiety, and particularly if you feel insecure, because part of boy culture is about top dog. Who's the best, who's the fastest, who's sort of up here, and then this frequent challenge to that top dog that comes in the pack. What do you do if your child is resistant to executive functioning strategies? Allison is asking. I would sit down with your son and I would ask him, what are the number three things, or maybe even just the number one thing you are struggling most with at school. And then I would target that thing and brainstorm some possible solutions, things that you've tried that haven't worked, things that you haven't tried that could work, and pick one. Because what happens to a lot of kids who have ADHD, boys and girls, is they're overwhelmed by interventions, and it's too much for them. And so if your child is resistant to learning executive functioning strategies, maybe he feels like, A, no one really understands his brain and is listening to how he thinks it should work, or B, it's too much and he needs to narrow the field. Christy, my 10-year-old son doesn't like to read. How can I help him love reading? Well, Christy, honestly, what I want to say to you is he may not ever love reading. I can't tell you how many kids with ADHD I work with who do not love reading. There are plenty who do, but there are plenty who do not. It's hard for them. One thing could be to have him read on electronic reader, whether it's a Nook or a Kindle, where he can increase the font so that there's not so many words on a page. That can be helpful. The other thing is to have him read things that interest him. Some kids I know only read the sports pages in the paper or Sports Illustrated. That's fine. They're not they don't like books. Maybe they only like a certain type of book, or they'll only read a little bit at a time, or they like to listen to books. So there are a lot of different ways for kids um, to become comfortable and interested in reading, usually by a subject matter that interests them and a format that makes it easy for them to do. Okay, next batch of questions. All right, Amanda. My son has hypermobility and lumbar lordosis, ADHD, SPD. He's very sad as he's got no friends, and he's a gentle young man who doesn't like to fight, as it makes him sad to just think about hurting someone or getting someone in trouble. During lockdown, a teacher called my son a safeguarding danger. Oh my God. I'm glad you put a complaint in front of the other students in the Zoom class, as he didn't want to go on camera. Now I can't get my son motivated enough to do anything for school. My son hates school. He doesn't want to go to school. Well, he's been publicly humiliated in the school realm. That's outrageous. And I just want to tell you, steam coming out of my ears. I'm glad you put a complaint in. And, I think that the motivation onus is on the school because they've messed up. How are they going to engage your son? And is there a different school that you could possibly send your sons to so he could start over? Because it sounds like this school isn't actually really working for him. I don't know how old he is, but maybe he needs a break. And could he finish out the rest of the year by just doing online school and then regrouping for next year? Maybe he would do better with some tutoring, but I would really put the onus back on the school. Neldrika, my 10-year-old son pulls threads on his clothes or towels or shreds paper, workbook, paper, or tissue paper. Does this have anything to do with ADHD? He might need a fidget. Whether it's pulling clothes or picking at skin. Some kids, some boys and girls with ADHD really benefit from having some fidgets. Otherwise, they make fidgets of their own, such as skin picking. And that can also be a manifestation of anxiety. So I would maybe explore, going to the dollar store, or maybe going online and buying a fidget or two. There's some neat ones where they actually, the things, it's not just the spinners. There are boxes that have, like, you push a button and there's a knob that you roll, and that might be helpful. Lainey, my son is 16 and he says he feels like he's broken and his brain doesn't work. He is very stuck on I can't. Oy, and resistant to any new techniques to help him. I'm sorry. I'm very sorry to hear that. I'm curious why he's broken. In what way doesn't his brain work? He may be at a place where he says, I can't, because he doesn't think anything will work. He feels like he's failed and he doesn't see times where he's succeeded. And so the question I would want to ask is, where is a place where your brain works fine? Where is a place where you feel like you're intact? When does that happen? And is I can't a shield for I'm afraid to fail again? Because if that's the case, then we have something that we can deal with. So I would really work with him on his fear of failure. And maybe that would be seeing a counselor or seeing someone at school. But what he's afraid of is that he's tried these things and nothing's helped. That's what I hear from a lot of teens. Nothing's worked. Why is this going to work? And what I say to them is, well, we haven't tried this, and you have me as a support. And so you want to find someone who really is an ally, who could be someone that your child looks up to and can work with. Stephanie asks, how do I make my son accountable without shame? He thinks everything is his fault. Well, there's a difference between shame and guilt, as we know from Brene Brown. Shame is I made a mistake and I'm a bad person. And guilt is I made a mistake and I feel bad about it. I wish I hadn't made that mistake. So it's the I'm a bad person part that is the toxic part of shame. And so what we want to do is to help kids with ADHD understand that you're supposed to make mistakes as you live. I'm sure for you, as the adults who are on this, and maybe even some of the young people, if you're on, that there have been times where you've made a mistake and you've learned something important from it. That's what life is, living and learning. And that's what a growth mindset is about. I do something, it may work out, that's great. It may not work out. I have to regroup and try again. And that is what we want. That's what living and learning is all about. Donna says, I'm having a hard time with my 13-year-old son. He is angry all the time and will not go to school or do schoolwork. He will fail the 7th grade if he doesn't want to do anything. He fights about everything. It sounds like your son might be depressed, actually. And anger is the gatekeeper often for depression in boys, particularly middle school boys. He may feel overwhelmed by school and by the failures that he sees that he's accumulated. And so he doesn't know what to do or how to get started. The bar may be too high for him, in which case you may want to lower it to the bare minimum so he can get through and finish. Emer says, any advice on taking meds? My son is sensitive to taste and refusing to take his meds. He's 8. Yeah, some kids really hate taking their medication because they don't like how it tastes. Applesauce, yogurt, maybe putting it in a smoothie. I have one family that he could have a spoonful of chocolate ice cream or chocolate pudding whenever he took his medication. Also, you can try drinking it down with a carbonated beverage. One family I didn't like Coke, but Coke or 7-Up, but they allow their kids to have an Orangina or something, like that, so that the bubbles kind of help the pill go down. My son gets very emotional, Ashley says, and angry when he's given constructive criticism. How do I help him be more accepting of this? He automatically starts saying, fine, I'm just not good enough anyway, and shuts down. So actually, this is a great question, and it's, oh my gosh, 4:49. So I'm going to do one more question, and then I'll stop. So one of my clients said to me, Dr. Sharon, there is no such thing as constructive criticism. It all sucks. So excuse my language, but that's how he felt. It's like, what is constructive? There's nothing constructive about it. It's all about what I do wrong. So I think we want to shift, right? When I taught in my book, What Your ADHD Child Wishes You Knew, and in my card deck, I talk about celebration. Remember that the ideal positivity ratio is 3 positives for every negative. Most kids with ADHD experience anywhere from 1 positive to 10 negatives a day, and sometimes 1 positive to 50 negatives a day if they add in what they tell themselves. This is what kids have told me. This is what parents have told me. So your son is only hearing the negative, and that is actually how our brains work in terms of the negativity bias. We hold on to the bad stuff to try to help us not make the same mistake in the future. It doesn't always work. So if he's not good enough anyway, if that's how he's feeling, we have to flip it to show him times when he is good enough. So he can start to have a different narrative in his head. And so that means paying attention and giving specific positive praise for when he does things that you ask. And then work with him, collaborate with him on one area that needs improvement that he sees and you see. Then that's what you're going to work on only. Okay? Seni asks, how do you handle the back chat? So I think you're meaning the talk back or the pushback. And I think that for boys with ADHD, a lot of them are trying to be funny. So they have these quips that they want to say. They're also trying to establish their power, their autonomy, in if they're going through puberty and adolescence, like who I am versus who you are. And so what we want to do is we want to talk with them about what's okay to say and what's not. In my house, my kids would talk back, and sometimes I would say, fresh is for vegetables. So anytime, and they would like roll their eyes and laugh, and I would laugh. So anytime you can add humor to the situation, it's better for you and it's better for your son. So instead of getting angry, don't you dare talk to me like that. You can be like, fresh is for vegetables, which gets your point across, but it's not bringing the anger into it. Or talk, think of something else that would work. Ask him what you should say when he's speaking inappropriately to you. Interrupting is something different. And a lot of times kids with ADHD interrupt because they just can't help themselves. And so in that situation, what you want to say to them is, hold on, I'm still speaking. Take a breath. If you can't remember it, write it down. Count to 3, let me finish. And you're going to have to rely on your patients because they don't naturally have the impulse control that you would like them to have. Okay, so it is time to stop. This has been a very strange session. We have 1 or 2 more questions. I'll take these 2. This is from Sigrior. My 14-year-old is newly diagnosed and has a lot of prejudice against ADHD in general, especially against medication. I think he would really benefit from taking medication. How do I help him accept his diagnosis and taking medication? Information. You need to teach your son about his brain. And you can do that yourself. You can do that with a psychologist or a therapist, but he needs to understand what his strengths are and what his challenges are and what medication actually does. Many teens are afraid of taking medication because it will change them. It will make them a zombie because they don't understand the mechanics of how medication actually works. That is something that would help him. He can make a decision. The other thing you want to say to him is, how much are you suffering? How much are we suffering? This may be something that could reduce that suffering. It's worth trying. It takes time for kids to accept that they have ADHD. No one wants to have a disorder. Do you? I don't. So we have to remember that it's a process, and we really have to hold it as a uniquely wired brain. We all have unique individual brains. Some kids have anxiety. Some kids have depression. Some kids have a learning disability. Some kids have ADHD. That's how it goes. Mary, my 10-year-old son has ADHD. He has a hard time regulating his emotions. He has very explosive tantrums whenever he is frustrated or things don't go his way. It is so impulsive that he doesn't think of consequences or try any calming strategies. We have him in therapy, but that doesn't seem to work either. Is he in therapy with you? Because individual therapy for a 10-year-old is not going to be as effective as therapy that involves the family, because the most effective treatment for ADHD is a combination of medication and parent education and family therapy. Kind of the same thing, because you're with him a lot more than the therapist, and his explosiveness is a family issue. It's not just about him. How you respond is just as important as what he's doing. So I think it's important that the therapy involves everybody. That will also help him in terms of seeing this as a relational issue instead of something else is wrong with him. And that's why I'm such a strong proponent of family counseling for kids with ADHD. They already feel bad about themselves. So if we can look at it as our family needs some help living with ADHD, because now we are a family living with ADHD, and this is how we're going to get it. It takes some of the pressure off the boys and girls. Thank you so much for joining me. My name is Dr. Sharon Saline. Please check out my website, www.drsharonsaline.com. There are lots of resources there. I also have a YouTube channel. And of course, follow me on Facebook. I'll be your friend forever. And that's where I post all kinds of updates about what I'm doing, but also information about living well with ADHD. Thank you for your patience today, and I hope that you have a lovely weekend.